Hello everyone, welcome to the today's class. Today we are going to discuss about the most common cardiac disorder, that is hypertension, which is one of the most widely prevalent cardiac condition. So in continuation to the yesterday's introduction to the cardiovascular system, so today we are going to discuss about hypertension. So before starting topic, what I want to say means these notes I have prepared according to the Pharm syllabus, which is relevant for other courses also. However, the notes what I am showing here are quite relevant for the exam point of view also. So these notes will be updated in my Telegram channel within a week or 2 weeks. So stay tuned with us in the Telegram channel also. Having said that, let's start the today's condition, hypertension. So what is hypertension? Hypertension, if we will break the terminology, so what we can see means we can get two different section. One is hyper. What is this hyper? Hyper means to increase. In our day-to-day life also we are telling ki hyper. Hyper means to increase or more than the normal. Then tension, in a technical word, tension is nothing but the pressure. So if we will club these two words, then we will get increasing the pressure. So what pressure it is increasing? It is increasing the blood pressure. So our blood pressure is getting increased than the normal range. Then that condition is known as hypertension. So here in blood pressure, what we have to understand, as I have discussed in the normal physiology of cardiac system. Now you just see here, this blood pressure, this if we will understand this one formula, one concept, then it is very easy for us to understand what is the concept of hypertension, what is the principle of hypertension. Now here this blood pressure can be defined as the cardiac output. What is cardiac output? In yesterday's class also I have discussed, into peripheral resistance. Now yesterday also we have seen how cardiac output can be calculated. Cardiac output can be calculated as a heart rate. What is the heart rate of an individual in a minute multiplied by the stroke volume, then that is multiplied by the peripheral resistance. Now if there is a sum of all these three parameters, we will get the end parameters known as blood pressure. Now let's understand this with one example. Right now this is one heart. Let's say this is one heart. This heart is pumping blood and it is beating at a rate of 80 beats per minute. Let's say 80 beats per minute. And its stroke volume. Stroke volume means what? At one heartbeat, how much blood is getting pumped? How much blood is getting pumped from left ventricle. So this we have to understand. Let's say example, we will take some amount. Let's say example, it's a 70 ml. What is the stroke volume? Stroke volume is now 70 ml. What is the heartbeat? Heartbeat is 80 BPM. Now there is another parameter called TPR, or generally we will tell it as a PR. This PR is not permanent residency. This is called peripheral resistance. What is this? This is peripheral resistance, or this TPR we will add total here, total peripheral resistance. Now let's understand the concept of peripheral. You have understand the concept of BPM, you have understand the concept of stroke volume. Now let's understand the concept of total peripheral resistance. Now just imagine this is a blood vessel. So this is a blood vessel. Now this is an endothelial layer in our blood vessel, the innermost endothelial layer of blood vessels. Now blood is flowing through these blood vessels. Now there are RBC. RBC are biconcave disc-like structure. So when this blood is flowing, these cells will be floating and going through these blood vessels in one particular direction, right? In arteries and all. Now if we will see, this wall is there because there is a blood and there is a pressure in the blood. Due to this pressure is generated by heart. After pumping only, this pressure is getting generated by heart in the arteries. Basically, we are discussing about arteries and arterioles. Now, when this heart is pumping the blood, this blood is pumped through the blood vessels. When this blood vessel is getting pumped through the arteries, this wall will exert certain pressure. This blood will exert certain pressure in the walls, and this wall will exert certain pressure in the blood. And there is a lumen. This is opening in the blood vessels, that is called lumen. This blood will flow through the lumen. However, while flowing this blood, this wall of the arteries or wall of these blood vessels will have some resistance. Resistance means they will oppose the pressure given by the heart. So in the long run, this pressure will be normalized. This will be nullified due to this particular resistance pressure. This resistance pressure exerted by the blood vessels, wall of the blood vessels, that is nothing but the total peripheral resistance. Now, here what we have to understand in this concept means, we are telling ki BP is equal to heart rate into then stroke volume into total peripheral resistance. Now you just see here, if heart rate is increasing, obviously BP will be increasing. Yes, if stroke volume is increasing, BP is increasing. So this we will take it in a lump sum. This is known as cardiac output into total peripheral resistance. Now, if cardiac output is increasing, BP is increasing. If resistance is increasing, BP is increasing. Now here what we have to understand means, if these blood vessels will get narrow, this will get contract. What is happening? This is getting contraction. When this will get contraction, it will become narrow. It will become narrow. So it will become narrow means pressure will increase. Pressure will increase. Like we are having pipe of motor at our home. If we will press it, pressure will increase. Similarly, if it will become narrow, if it will contract, it will become narrow, pressure will increase. Total TPR will increase. BP will increase. If this will get widened or this is get dilated, this lumen will become larger. Then the total peripheral resistance will be reduced. Once total peripheral will be reduced, BP will also reduce. Now, what is the relation with blood vessels? If the blood vessels contract, BP increase. Blood vessel dilate, BP decrease. So this concept we have to keep it in our mind. We are having a lot of medicines which are working in this mechanism also. And hope now you understood the concept of total peripheral resistance and how we are going to calculate the blood pressure. Now, with this background, having said that, we will start the today's topic. What is blood pressure? Now we will go to the definition with this background, right? Blood pressure can be defined as the persistent. So here what is an important point? Persistent. Like you see, now I will go for running or doing some physical exercise, my BP will go up, right? It's usual. But after some time it will be normalized. It will be normalized in my normal situation. But if my BP is increasing in a normalized situation and for a persistent time, persistent means continuously it is elevated, whole day, at night, sleeping time also, every time it is persistently increasing, then we will tell it as a BP. Sudden increase is not a hypertension, but it's a persistent increase, rise of the blood pressure above. What is the range? Systolic blood pressure is 140 and diastolic is 90. So now let's understand what is the concept of systolic and diastolic. Now let's assume again this is a heart. Right, when this ventricle will get contract, this blood will be pumped via aorta. Blood will be pumped via aorta to the body. When it will contract, due to this contraction, one pressure will be generated. What is this contraction pressure? What is this contraction pressure? This pressure is known as systole. This pressure is known as systole or systolic pressure. This is known as systolic pressure. Now, once this blood is pumped, this will get dilated or it will get relaxed. Here semilunar bulb will get closed so that blood will not come back. Then blood from atrium will come to the ventricle. Blood will come to the ventricle from the atrium. During this time what will happen, this ventricle will be relaxed. Pressure will be released so that blood from atrium will come to the ventricle. And the pressure during the relaxed time of ventricle is known as diastole. Hope you understood now. This is called diastolic pressure. So, what we have to understand, if systolic pressure is 140 and diastolic pressure is 90 or above than this, then we will tell it as a hypertension. This is the definition according to the World Health Organization. Right? It should not go beyond 140 in systolic and not should go beyond 90 in the diastolic. Right? And I will again give you one small tip. Diastolic, increasing in diastolic is even more dangerous. Systolic is also dangerous, diastolic is dangerous. Why? What is the reason? Because if diastolic is always elevated, it simply means our heart is not getting proper rest. So our heart requires proper rest because it has to work for a lifetime. So that we need to understand, right? Hope we have understood now. Now let's discuss its normal range. For exam point of view, systolic, it is always in a range 90 to 140. If pressure is above 140, it's hypertension. If it is less than 90, it is a hypotension. Similarly, in the diastolic, if it is more than 90, it's hypertension. If it is less than 60, it's hypotension. If these both are increased, we will say it as a hypertension. If systolic is only increased or diastolic is only increased, other than the normal, then this is called isolated hypertension. What this is called? This is called isolated hypertension. Sometime you may get this question in your Viva or sometime in 1 mark examination or during your practical examination also. So we need to understand that. Hope we are now clear with this particular statement also. Now we will see some information, additional information regarding blood pressure. So this hypertension in another term is known as silent killer. So in day-to-day life we are telling it as a silent killer. Many of the cardiologists will say it as a silent killer because the hypertensive patient does not have any specific sign and symptoms. Once the things are very worse, then only they will end up going to the hospital. Generally it is a hidden type of condition. That's why it is called silent killer, but associated with a lot of cardiac and other vascular disorders. Then what is the another fact about this? This is serious. Hypertension is very serious nowadays and often not diagnosed, because to diagnose the hypertension one needs to measure their blood pressure. To measure that, generally we have to go to the healthcare institution, and nowadays some people are educated and they started keeping the sphygmomanometer at their house also to continuously monitor the blood pressure, because now the automatic devices are there which are easy to use. However, it often remains not diagnosed, right? So this is another fact about hypertension. Another is not treated. If some people are diagnosed also that they are having the elevated blood pressure, still they will not treat it. They will not take it seriously because it is having long-term consequences. At short term, we are not seeing such any adverse effect. That's why people will generally not treat it. They will neglect it. This is another fact. People will neglect the hypertension condition. And what general people will think means, in the Indian scenario, it is linked with mood. Why I am telling it is linked with mood? People will say कि मेरे को गुस्सा आता है, I am getting anger and I am stressed. क्या मेरा BP तो नहीं बढ़ा है? They will just correlate their BP with their anger and mood, or sometimes with the stressful situation only. However, it's not truth, right? It is having large spectrum rather than just anger, stress and mood disorders. Now, what is the important point? Only way to diagnose hypertension is to get your BP checked. So there is no any other way we can say someone is having hypertension. So these are some commonly accounted facts about the hypertension. Hope these all points are clear to you. Now we will see the epidemiology. So this might be very new, as this is our first class of Pharmacotherapeutics 1. Now all of we should understand what is epidemiology. So let's say about hypertension only. How this hypertension is distributed in the population, in the Indian population or in the state population or in the city population, and what are their determinants. The determinants मतलब कि इसको factors affecting to it. These are known as factors affecting to hypertension. We are now discussing about the hypertension. So how this hypertension is getting affected and what is the pattern of its distribution in the population. This is nothing but the epidemiology. So here onwards, whenever we are seeing any section of epidemiology in any of the disease, in the coming disease, we should understand that what is the distribution of that disease, distribution pattern and the determinants factor for that particular disease. So study of that is known as epidemiology. Now let's quickly go through the epidemiology. Almost half population is unaware of increased BP. People will have increased BP, but they will be not aware because they will not go to the hospital. And in Indian population, we are regularly seeing, we don't have that habit to go with the regular health checkup. We will think paisa chale jayega, a lot of money will go, and we will just ignore until unless we are not getting any illness. Now, only 1 in approx 5 are controlling BP. Out of that, जिनको मालूम है who are actually diagnosed, out of that also only 1 in 5, 20% people are managing their blood pressure effectively. Remaining will be often neglecting the situation. So that is the magnitude of hypertension. Now in Indian, 1 in every 4, 1/4 of adult live with hypertension. This is the danger situation. This is alarming situation. This is, I am not telling, this is the data, collected data is telling, right? Now, out of this 1 out of 4, only 10 to 12% have their controlled BP. BP cannot be cured completely. Who are telling they will control BP by giving some drugs and all, that may not be the true case, because it can be only controlled as of now by giving some medication. There are a lot of measures, non-pharmacological measures, that can help us in controlling BP, but not to cure it from root. So that we have to understand. Now, one of the biggest risk factor for CBD and metabolic disorder. What? This hypertension itself is a disorder. I agree with that. In addition to that, it is again a risk factor for some other cardiovascular disease also, and some other metabolic disorders, like diabetes and all. They both share the common pattern, common risk factors and all. So that we have to understand. Now, let's classify hypertension. So hypertension, so Joint National Commission, JNC, is a organization which will extensively work in the cardiovascular disorder. In that also, hypertension is the major area of their research. They are having the various guidelines. So JNC is the latest guideline given by them. In the 2014, they have given JNC guideline. After that, in 2017-18, American College of Cardiology and American Heart Association, they have updated the things. However, for exam point of view and for the larger understanding, we will go with the JNC 8 criteria. Now, what is the normal blood pressure? It should be, systolic should be less than 120 and diastolic should be 80. Now, pre-hypertension, if our systolic BP is between 120 to 139 and diastolic between 80 to 89, means it's pre-hypertension. Means now I am not having hypertension, but in future I may get if I am not aware about my health condition, diet and all other things. Similarly, stage 1 hypertension which require medication is 140 to 159 systolic and 90 to 99 diastolic. What JNC 8 says ki pharmacotherapy is required. Drug is required in stage 1. That is what the recommendation of JNC 8. Stage 2, if our systolic is more than 160 and diastolic is above 100, then this is known as stage 2 type of hypertension. Hope this classification you have understood. So there are some other type of hypertensions also that we are going to discuss at the last for our viva and practical points of view. Now, we will see what are the risk factors. So, in various places, we will see what are the causes of hypertension. What I believe and what I think is good for the Schedule J drug, which are non-curable or chronic disease, Schedule J disease. In such conditions, we don't have any cause, right? We don't have any exact cause. Rather, we will have the risk factors. So why we are saying risk factor means कि if these factors are there is a higher chance. Prevalence is high to get the disease. So chance is high if risk factor is there. It does not mean कि person will have disease because he is having this risk factor. Cause means if there is a cause, there is a disease. Let's say example tuberculosis. Tuberculosis में क्या होता है कि Mycobacterium tuberculosis है तो TB हो रहा है. टीबी हुआ है मतलब कोई ना कोई माइक्रो ऑर्गेनिज्म है. आई एम वेरी डेफिनेट, आई एम श्योर. बट जैसे मैं यहाँ पे बोल रहा हूँ कि स्मोकिंग हाइपरटेंशन को कराता है, इसका मतलब ये नहीं है कि कोई स्मोक करता है तो उसको हाइपरटेंशन होता ही है. हाँ, इसका ये मतलब होता है कि ही इज हैविंग हायर रिस्क ऑफ getting hypertension compared to one person who is not smoking. So that is the actual concept of risk factor. So with this background, now we will start the risk factor. So we will basically classify now BP into two different category. One is the primary or essential hypertension. Why it is happening, we don't know. This is accompany around in 90% population. Similarly, another is secondary, where we know the exactly cause and which is secondary to the any other organ system disease or any other condition. So which is accounted in less than 10% population. Means if there are 10 hypertensive people, out of that 9 will having the essential hypertension, 1 is having the secondary hypertension in general, right? So what are the risk factors? First is idiopathic, means I am not sure ki what is the condition or what is the cause. but BP is increasing. Second is the genetic predisposition. If my father and mother, they are sharing the conditions like hypertension, I am at more risk. Another with genetic, we will link the kitchen also, right? If my father and mother, what they will eat, they will give same to me. ऐसा तो होगा नहीं कि मेरे घर में किचन पे मम्मी पापा कोई अच्छा सा मसालेदार खाना खा रहे और मेरे को खाना उबाल के खिला रहे. दैट इज नॉट द केस इन द Indian kitchen especially. So genetic also says the kitchen history also and the lifestyle also, right? How my mother, father will live, similarly I will also live. The lifestyle will be almost same. It will be never like, my father and mother will be sleeping till 10 o'clock and I will be waking at 4 o'clock and going for walk and exercise. So that is, very unrealistic. So all these things are associated with the hypertension. Then smoking and alcohol. So there are many causes why these are leading to the hypertension, but let me focus something. Smoking and alcohol, what they will do over the period of time, various compound, nitrobenzene compound in the smoking and some other harmful compounds in the alcohol, what they will do, they will go and continuously they will be there in the blood. Here nicotine and other nitrobenzene compound in alcohol, alcohol traces, formaldehyde, aldehyde, all those things will be there continuously in our blood circulation. Due to that, what is happening means these blood vessels, as I have discussed in the total peripheral resistance, these blood vessels are having one fine property called ductility. They will contract. When their blood will go, they will relax and they will contract. They will contract and they will relax. They will relax and they will contract. So these things continuously going on so that it is maintaining the blood pressure. Now these substances, they will harden these blood vessels. They will decrease their डक्टिलिटी, राइट? इसका जो एक लचकदार होता है, लचकपना होता है, उसको वो कम कर देता है. ड्यू टू दैट व्हाट हैपेंस, दिस कंडीशन इज नोन एज आर्टेरोस्क्लेरोसिस. आर्टेरोस्क्लेरोसिस मतलब होता है आर्टरी हार्ड हो जाती है. दिस इज डिफरेंट फ्रॉम एथेरोस्क्लेरोसिस, दैट इज अनदर कॉज. वी विल सी आर्टेरो मीन्स दिस इज हार्ड. नाउ दिस कैन नॉट एकोमोडेट विद द ब्लड प्रेशर. ड्यू टू दैट व्हाट इज हैपनिंग, टोटल पेरिफेरल रेजिस्टेंस इज इंक्रीजिंग. Total PR is increasing, obviously BP is increasing, right? Now another is the obesity. We all know that physical exercise will help us in losing weight also, and the excess of adipose tissue is directly linked with the cardiovascular disorders. It hampers with the cardiac output. It hampers the cardiac health. It hampers our blood vessel cells. Even arteriosclerosis is a product of obesity. All those things we can see. Then sedentary means ज्यादा बॉडी में मूवमेंट नहीं है, पैदल चलना फिरना नहीं है, राइट? बॉडी जनरली रेस्ट में ज्यादा रहता है, ज्यादा देर सोना, कुर्सी में बैठना, ट्रेवल करना है तो कार पे, बाइक में ट्रेवल करना. आवर बॉडी इज नॉट गेटिंग प्रॉपर मूवमेंट, दैट इज कॉल्ड सेडेंटरी. एंड other lifestyle factor also, not doing proper physical exercise, not giving a proper diet to our body, then luxury, luxury will lead to the sedentary. This sedentary will lead to the obesity, and this obesity will lead to the other issues which will lead to the hypertension. Then increasing salt intake, right? So here what I will try to explain is, salt is like Ram and water is like Sita. Where salt will go, there water will also go. Why it will go? Because salt has to maintain its osmosis, right? So wherever salt will go, there water will also go. Then if salt is there more in our blood vessels, to maintain the osmolality, our blood vessels will trap more and more water. So now there is a more water means there is a more volume. Once volume is increasing means stroke volume is increasing means what is the relation? BP is also increasing. So in that way salt intake will increase the BP. So we have to mindfully take our salt what we are consuming in day-to-day life. Stress is highly linked with the hypertension. There are various neurohumoral mechanisms which are affecting the heart. We will discuss in the pathophysiology. Similarly, lack of physical exercise, yes, right? This lack of physical exercise will lead to the sedentary lifestyle, obesity, and ultimately lead to the hypertension. Similarly, aging process over the period of time, our cardiovascular system will get weakened, and even our blood vessels, the ductility property will slowly reduce, which will lead to the BP. And there may be various other factors also, that might be not known now. In future, we may get some idea about them. That's why I have kept here some additional whatever. So all these factors, we are thinking ki if one person is taking more salt, he is at more risk to get the hypertension. It does not mean that he will have hypertension. Yeah, he is having high chance to get the hypertension. But exactly, we cannot say that he is taking stress, he will be having hypertension. But there is a group. All these will work together so that person will get the hypertension. That's why we are telling it as a essential or primary hypertension. Hope you have understood the risk factor for this. Then the risk factor for the secondary is, these conditions occur quickly, and this is very severe condition because it is secondary to some other conditions. Definite underlying causes are there, like sleep apnea. रात को जब सोता हूं तो मेरी सांस अटक जाती है, वो कंडीशन में भी हाइपरटेंशन हो सकता है. कोई हार्ट का डिफेक्ट है, वल्वुलर डिफेक्ट है, वाल का डिफेक्ट है, या फिर जो कार्डियक आउटपुट है उसी में डिफेक्ट है, उसके वजह से हाइपरटेंशन हो रहा है. सब रीनल कंडीशंस, ARF, CRF रीनल कंडीशंस है जिसकी वजह से बीपी बढ़ रहा है. Similarly, some medications are there. If we are taking the medication for a chronic term or for a long term use, they may increase the BP. Similarly, some metabolic conditions like thyroid. अगर किसी को हाइपरथायरॉइडिज्म है तो बॉडी का मेटाबॉलिज्म बढ़ जाता है. उसको मीट करने के लिए बॉडी को ऑक्सीजन भी ज्यादा चाहिए, एनर्जी भी ज्यादा चाहिए, तो हार्ट को बहुत ज्यादा काम करना पड़ता है. तो उसके लिए हार्ट विल इंक्रीज द प्रेशर टू मीट दैट डिमांड व्हिच विल लीड टू द हाइपरटेंशन. सो ऑल दीज व्हिच आर हैविंग नॉन कॉज विल कम अंडर द सेकेंडरी टाइप ऑफ हाइपरटेंशन. नाउ in another way, how we could classify these risk factors which we cannot modify. Let's focus on which we cannot modify. Age बढ़ता ही रहेगा, हम उसको रिवर्स नहीं कर सकते. जेंडर जो मेल हो गया, फीमेल हो गया या ट्रांसजेंडर हो गया, उसको हम चेंज नहीं कर सकते. एंड मेल आर एट हायर रिस्क, female they are having various mechanism so that they are at the lower risk, especially due to the estrogen hormone. They are having the estrogen hormone which is having the cardioprotective activity, cardioprotective and neuroprotective other activities are also there in women. So we will discuss in the dyslipidemia. Then another is the ethnicity. Some racial like African people are different from Hispanic people, they are different from the Latin American people, they are different from the Indian people. So this ethnicity also plays important role in the progression of disease. That also we cannot change. Now once I am from the Indian origin or South Asian population, I am from Asia Pacific region, means I will be always Asia Pacific region person only. And genetics, I cannot change my genes. But except that, whatever all the factors we have discussed here, that can be modified. Like cigarette smoking, I can modify. Alcohol, I can stop. Salt, I can modify. Stress, yes, I can go with meditation, yoga, I can reduce that. Physical exercise, I can do. So all the other things I could modify, and those are known as the modifiable risk factor. Hope you have understood this concept also. Now in today's class, let's discuss about the pathophysiology. Then remaining thing we are going to discuss in the another class, right? Management we will be discussing in the another class. Now please let's try to understand pathophysiology. What is the pathophysiology means? How this disease progress. That is called pathophysiology. There are multiple interaction system, as we have discussed. BP is equal to CO into PR. Wherever CO is increasing, BP is increasing, and PR is increasing, BP is increasing. So let's give our first theory. If there is an increase in the peripheral resistance, arterial vasoconstrictions will be there, right? क्योंकि यहाँ पे हम PR जो बढ़ रहा है, हम वो वाला situation देख रहे हैं. In this situation, what is happening? Arterial vasoconstriction is happening due to various reasons, right? Various factors. Now what is it is now this stroke volume is increasing. How this stroke volume is increasing means there might be vascular remodeling due to the age, cigarette smoking, lack of physical exercise, and all those things. It will lead to the hardening of vessels, that is called arteriosclerosis. Now if vessel is stagnant, as हमने देखा एक पानी का पाइप है, तो उसमें अगर वो ज्यादा देर तक मूव नहीं करेगा, there will be the algae, right? Similarly, if these vessels will not contract and dilate, the fat deposition will be very easy in the blood vessels, which will lead to the atherosclerosis. Now this atherosclerosis and atherosclerosis, they are the brothers. One will come, other will come automatically, and they will decrease the lumen size, which will increase the total peripheral resistance. Ultimately they will increase the BPs. This is the mechanism. And there is one another point, there is a decrease in the nitrous oxide. So this nitrous oxide is nothing but the one compound which is released by our endothelium of blood vessels only, and it will help in dilating the blood vessels. If its secretion is reduced, it is again leading to the vasoconstriction, which is leading to the increased PR, leading to the hypertension. Similarly, there are some components called endothelin. They will help in the constriction of blood vessels, right? So there is a balance of dilation and constriction by nitrous oxide and endothelin. Now if this dilation is reduced or constriction are increased, it will lead to the increased peripheral resistance and increased BP. Hope you have understood this. Now our another important is the RAS mechanism. In the another page we are going to discuss it in detail, but now let's understand. Once renin is increasing, angiotensin is increasing. Angiotensin is increasing means TPR is increasing. TPR is increasing and cardiac output is increasing. So if cardiac output and TPR is increasing means BP is also increasing. In detail I will show you in the another chart. Now this is a comprehensive overview how the hypertension occur. Now you just see, this is a brain. In brain we are having one area called medulla oblongata where we are having the circulatory centers. सर्कुलेटरी सेंटर जिसको हम बोलते हैं कार्डियोवैस्कुलर सेंटर. यहाँ पर रेस्पिरेटरी सेंटर भी होता है. दिस कार्डियोवैस्कुलर सेंटर विल कंट्रोल द कार्डियोवैस्कुलर रेट एंड रिदम. What is happening means, if there is a low BP in our body, so what this medulla oblongata will do means, this medulla oblongata will give message to the heart through beta receptor कि pressure is low in our body, you need to work harder and faster. So after it will give message to the beta receptor, this beta receptor will increase the rate and depth of contraction. Rate means ज़्यादा rate हो जाएगा, depth मतलब powerful contractions will be there. Due to that, what is happening? Stroke volume will be increasing. This stroke volume and heart rate both are increasing. Due to that, cardiac output is increasing, which is ultimately leading to the increased BP. Now, once BP is in a normal range, if it is increasing so much, this heart will give negative feedback कि BP बहुत बढ़ रहा है. Then medulla oblongata it will send message and medulla oblongata will say, okay, we will stop here. So this is one normal mechanism. In another way, what is happening means it is giving message to the kidney also. So key pressure is low, it have given message to the heart. Same time it will give message to the kidney also. Kidney will sense that message and what it will say? It will say let's activate RAS mechanism. Then once this RAS mechanism is activated, it will go to the heart so that the CO will activate, and similarly this RAS will act in the blood vessels also, and it will increase the TPR, total peripheral resistance, which will increase the BP. Once again BP is normalized, it will give feedback to our brain system. This is how finally blood pressure in our body is maintained. Once this cycle is disrupted, it will lead to the hypertension. This cycle is not working properly or there is some bug in this cycle, then it may lead to the hypertension. That we need to understand. Now let's see the actual pathophysiology in the detail, that is a RAS mechanism. Then we will stop today's class. Now in RAS mechanism, as you have studied in the human anatomy and physiology also, I will just go with the summary. What is happening? Once the blood pressure is low, right? Blood pressure is low means blood will reach in less amount to all the organs. Now kidney is a vital organ which is having the profuse amount of blood circulation for the filtration process. जैसे ही BP will drop down, our blood which is reaching to kidney will also get low. Once this pressure is low, our nephron will sense it. Then there is one special cell called juxtaglomerular cells in our nephron. What is the work of this cell? This is a sensor. This sensor will sense that there is a low blood flow in the nephron. Now let's increase the blood pressure so that my kidney will able to filter it properly. What it will do, this juxtaglomerular cell will initiate the production of a compound called renin. It will induce a compound called renin. Now there is one compound called angiotensinogen in our body. This is an inactivate compound, means it is rotating in our body, but this is in an inactivate form. मतलब इसका कोई भी काम नहीं है, ये just एक raw material है, it's just roaming in our circulation. Once this renin will be activated, this will get released. This renin will act in the angiotensinogen. This renin will act in the angiotensinogen, and it will convert this angiotensinogen to the angiotensin 1. What it will do? It will convert angiotensinogen into angiotensin 1. Then same time this renin will stimulate the release of angiotensin converting enzyme from the lungs. Angiotensin enzyme from the lungs. At the same time, what is happening? Due to this ACE enzyme from lungs, now this angiotensin 1 is converting to the angiotensin 2. Angiotensin 2. Hope you have understood up to here. Now this angiotensin 2, सारा खेल इसका है. All the gameplay is now depending on the angiotensin 2. One by one, what this angiotensin will do, we are going to summarize it here. First, angiotensin will go to the heart. It will increase the depth and rate of heart. ultimately increasing the cardiac output, increasing the BP. This pathway is clear. Hope we have understood. Angiotensin 2 will go to heart, increase depth and rate of heart, increase cardiac output, increase BP. This is one pathway. Another way, this angiotensin 2 will go to the blood vessels also. It will tell them to constrict. Once it is getting constriction, this will increase the total peripheral resistance. Total peripheral resistance is increasing means it will increase the BP. This is a first pathway. This is a second pathway, role by angiotensin 2. Another way, this angiotensin will go to our brain system also, and brain now will release one compound called vasopressin. What is this compound? Vasopressin. Vasopressin में कुछ example आते हैं जैसे dopamine, then adrenaline, norepinephrine. All these compounds are vasopressin. Similarly, similar compounds it will release from our CNS. Now this vasopressin will increase the blood volume, that is a one way, and it will even constrict the blood vessels also, increasing the total peripheral resistance, increasing the cardiac output, ultimately leading to the increased BP. This is a third pathway now. This is a third pathway. This is the first pathway. This is a second pathway. This is a third pathway. CNS is a third pathway. Now fourth pathway we will see how this angiotensin is working. This is a beautiful compound, angiotensin. Now what this angiotensin is doing, this angiotensin is directly going to the kidney and intestine, and it is telling ki let's retain sodium, because kidney will filter the sodium. Let's retain sodium and let's retain water also. Sodium and water is retaining means blood volume is increasing. Blood volume is increasing matlab cardiac output is increasing. Cardiac output is increasing matlab BP is increasing. This is a fourth pathway, how it is working. This is a fourth pathway. And in the fifth way, what it is doing, it is going to the kidney in the adrenaline gland. What it is telling, it will increase the aldosterone. One, so directly it is going to the blood vessels and telling it let's retain sodium and water. It is giving signal to the another system also from adrenal cortex, from the adrenaline gland. It will increase the aldosterone. This aldosterone will go to the kidney and intestine, and this will also say ki let's retain sodium and water. Due to that, again blood volume will increase, cardiac output will increase, ultimately BP will increase, right? This is a fine balance which is happening in our body. Wonderful mechanism, excellent mechanism, right? So this thing is going in our body and it is maintaining the blood pressure. It is maintaining the blood pressure. Now, if there is some problem in this particular system, it will lead to the hypertension. Any system, any pathway is hampered. This angiotensin is not coming, renin is not coming, or renin is coming at excess, angiotensin is converting at excess. It is doing more work, then the person will have the hypertension type of condition. Hope you understood this. Now let's take some brief note for today's class and we will summarize our today's class. Now, there is a abnormality in the baroreceptor mechanism. Baroreceptor मतलब जो हम CNS वाला mechanism बोल रहे हैं. Neurohormonal imbalance. We are discussing about the vasopressin, endothelin, and nitrous oxide. It will also lead to the hypertension. Abnormal RAS mechanism, as now we have discussed, will lead to the hypertension. Then permanent vascular changes. We are telling कि blood vessels will get hard, atherosclerosis will be there. Permanent hardening is there means TPR will increase, BP will increase. Nitrous oxide will decrease means BP will increase, and endothelin will be there means endothelin will also be more contraction will be there, TPR will be more, and ultimately BP will be more. So this was a entire pathophysiology of hypertension. Hope you have understood. Right now, before concluding the class, let's revise once quickly in 2 minutes. Then we will end it. Hypertension, persistent rise of BP more than 140/90. So less than 90 is again dangerous, that is hypotension. More than 140 in systolic, 60 to 90 in the diastolic. Also known as silent killer, you all know now why it is called silent killer. Serious, often not diagnosed, not treated, neglected, linked with mood, anger and stress. Only way to diagnose BP is to get it checked. Epidemiology, people are there but they are not getting diagnosed. If they are getting diagnosed also, they are not getting proper treatment. And if they are taking treatment also means effective control is not there. Right? It itself is a disorder, but it is a risk factor for other disorders also, other cardiac conditions, other chronic conditions also. How we can classify it? We can classify it based on the JNC 8 classification. Then what are the risk factors? Two type of hypertension, primary and secondary. Primary risk factors, but whether it is related or not, exactly I cannot say. Secondary, yes, exact it is there, more severe and quick are there. Something are there we cannot change like age, gender, ethnicity and genetics. Remaining all we could modify, which will come here. पैथोफिजियोलॉजी, अगर पीआर बढ़ जाता है किसी भी मेजर से, या फिर रास मैकेनिज्म में अबनॉर्मेलिटीज आती है, या फिर हमारे बैरोरिसेप्टर मैकेनिज्म में कोई दिक्कत आ जाता है, right? So this was the entire summary of RAS mechanism. Hope this class helped you. Now after pathophysiology we will go into the diagnosis and management portion that we are going to cover in the part 2. Stay tuned for that. Thank you. If you are having any suggestions, please write in the comment. Thank you.